are perfectly positioned to help us kind of think through the theme of our morning, everything, everywhere, all at once. Because certainly I think that adage is true most of all when it comes to health. And as we have seen throughout human history, and certainly over the last few years, when our health is at risk or imperiled, everything is at risk. And Emma, I know from kind of a GSK perspective, you understand that kind of interconnectivity isn't only rhetoric, but reality. Mm-hmm. And so I wonder if you could just share kind of how you think about kind of this charge to try to be everywhere all at once, while also, of course, having to focus some of your energy, efforts, and research on what you think are the most pressing challenges and where you can make a difference.
Sure. Well, thanks, Chelsea. I mean, it's absolutely true that we are facing into a very high-pressure, multi-stakeholder set of huge demographic, societal, economic, political shifts, all happening at a record scale and pace. And that affects every industry, but exactly as you say, it feels especially acute in healthcare. People are living longer. The over 60s already outnumber the under 5s, but often in many places in worse health. We've got this surge in comorbidities, whether it's obesity on the rise. We've got more than 50 million people worldwide living with dementia. 1 in 5 of us will develop cancer. And specifically, the burden and threat of infectious diseases, especially for the most vulnerable, is unacceptably high. Healthcare systems are under unbelievable and unsustainable pressure, and half the world's population simply does not have access to the healthcare that it needs. And yet, the economic and societal health of nations depends on the health of their populations. And people, simply put, are counting on companies like mine and our industry to deliver medicines and vaccines they need and can rely on. So at GSK, we really want to contribute to this at serious scale. Our goal is to reach 2.5 billion people by the end of the decade, and we focus on 3 simple things to try and navigate through it. The first one, and it's really the core of our job, is innovation. There are extraordinary leaps forward in science and technology that mean, for example, HIV used to be a terrible diagnosis, can now be a manageable condition, or actually prevented completely with just a handful of injections a year. And we're also beginning to be able to develop vaccines against pathogens that were once thought impossible, like malaria. And I have to acknowledge immediately how grateful we are to Tedros and the WHO, not only for their partnership, but for their pushing to help us roll out that vaccine to young children in sub-Saharan Africa. We're also working on 13 of the pathogens that you've prioritized at the WHO, and we're very ambitious for a new TB vaccine, which we're partnered on with both the Gates Foundation and the Wellcome Trust. But secondly, it's about access, because there is no point in having innovation if it doesn't reach the people that need it. And that starts with responsible, sustainable approach to pricing, like our tiered vaccine pricing, or that we open up our IP, actually, to the medicines patent pool so that around 90% of people living with HIV who are on treatment in lower income countries are actually on a regimen based on one of our antiretrovirals. And then our third and last priority, to get ahead of disease, literally, is about focusing on preventing it. Prevention. We have to partner with policymakers and health systems to prioritize prevention and earlier intervention to actually keep people well, supporting healthier lives in the community through access to vaccinations, screenings, and timely treatment, and getting also ahead of systemic threats like AMR, or indeed the next pandemic. So innovation, access, prevention, all in partnership is how we work hard to try and get ahead of disease together.
I think Dr. Tedros may have the hardest job in the world because the world expects him to help keep us healthy and to help us regain our health if we fall ill. And so I wonder, Dr. Tedros, if you can just reflect on in the myriad of challenges facing us now, from mpox to COVID to age-old scourges that Emma mentioned, including malaria and tuberculosis, as well as kind of rising threats to our mental health and well-being that we just heard Prince Harry discuss as an urgent call to action, particularly when it comes to our children here on the stage. Given the improbably high expectations of you and WHO and the myriad of challenges that seem to multiply daily, how do you think about prioritization and pushing forward so that you're always proving progress is possible?
Yeah, thank you. First of all, thank you for inviting me to join. And most of what I was hoping to say, I think Emma had said it, especially on the challenges he said. So without repeating, I will maybe add a couple of challenges the world is facing. Number one now is the conflict that we see in many parts of the world. It's becoming very difficult to deliver services in conflict areas. I just came from visiting Sudan and Chad. And the situation in Sudan is very, very tragic. More than 12 million people have been displaced. And half of the population, which is 25 million, needs aid. More than 80% of the health infrastructure in the conflict areas is destroyed. And I met mothers in the IDP camps and inside Sudan, and also the refugee camps in Chad. I visited Adre, which is the border town between Chad and Sudan. And what they tell you is so harrowing. Their houses were burned, their crops were destroyed, their animals were stolen. And they came to Chad with nothing. And as I said earlier, so the trend now, the serious challenge is delivering service in conflict areas. And the same is true with Gaza, as you know. More than 41,000 deaths now, 2/3 of them women and children. That should have been enough to end the war. But it's really ongoing. As you have heard, we had a very successful immunization for polio in Gaza. But imagine children are saved from polio today, but if they're dying tomorrow because of the conflict, so you say, what's the point? And then Ukraine, the same thing. It's women and children who are the most affected. But in all scenarios, the best medicine is peace. And all the conflicts could be addressed through political solutions. I'm a child of war. I know the smell of war. I know the image of war. And I know the sound of war. In war, except destruction, you get nothing. And when I was a child, my mother used to pray for me to survive one day at a time. And I know how mothers were impacted then, and I know how children were impacted, me one of them. Of course, becoming a director general from a survivor, just praying for one day is a miracle. Miracles happen. But that's why I always oppose war and violence, because there is no solution through violence and war. So that's one challenge which is trending now, and globally, as you know, almost everybody is worried. And I think we need peace. And as I said, it's the best medicine. And then the second, in addition to the other things you said on NCDs, mental health, infectious diseases, and so on, is climate change. The climate crisis is a health crisis. And it's affecting us seriously. And it's visible, palpable. Malaria, dengue, and other infectious diseases, cholera, are now on the increase due to climate change. Non-communicable diseases due to heat waves, cardiovascular disease is also on the increase. And mitigation, adaptation with a sense of urgency will be important, because when we talk about climate crisis, it's about now. And as you know, with fossil fuels, we know oil, natural gas, coal contribute more than 80% of the pollution, actually. And we know where to focus. The only thing that's missing is the political commitment to really implement. So these are the two issues, maybe the major challenges I would like to say. But if there is a will, there is a way, and we have known tools. I don't want to go into details on what should be done, but I think that the key is the political commitment will be important to mobilize all the solutions we need.
You know, another area where we need political commitment, Emma, is I know one that you at GSK have really focused on, which is antimicrobial resistance.
Yeah.
You know, which you referred to earlier as AMR, and I knew what you were talking about, but I don't know if everyone in the audience knew what you were talking about. And we know that that too, as we were just discussing backstage, is not disconnected from conflict or climate change. So I wonder if you can share a little bit about kind of the threat that AMR poses, why you're so worried about it, but also what you're doing about it.
Yeah, I mean, first of all, I deeply agree with Tedros. The science is so clear that the link between our planet's health and people's health is incontrovertible, and 3 of the top causes of death worldwide are in some way related to lung disease. So this is an urgent health issue as well as the infectious diseases. But you're absolutely right. I mean, one of the main reasons I'm in New York this week is for the UN high-level meeting, which is all about antimicrobial resistance, or AMR. And the reality is that if we don't do something about this, wake up, and make some changes, that 40 million people are going to lose their lives to AMR, to antibiotic-resistant infections by 2050. That's around 1 death every 3 minutes, and I think will take 2 years off global life expectancy. And you know, thinking about your theme here today, AMR really is everything, everywhere, all at once. It touches on so many of the challenges that we're all facing. It is a crisis of health equity, first. Sub-Saharan Africa sees some of the highest death rates due to AMR. And there are lots of factors at play here, including access to high-quality, effective antibiotics. It is absolutely a crisis of climate and nature loss, with warming temperatures and more flooding, meaning bacterial infection rates are on the rise. And it is a crisis of conflict, because tragically, war zones create ideal breeding grounds for resistant infections. And I read some just tragic research recently about what's going on in Ukrainian hospitals at the moment. So, you know, I think AMR needs to keep all of us up at night. Access to modern medicine is at stake, from the most minor injuries to complex cancer treatments to, you know, childbirth again, is all going to become riskier because that medical backstop is under serious threat. So what do we do about it? Well, I think from our point of view, and this is absolutely a question of partnership, because nobody can take this on alone, and it's going to be a question of policy too. The first thing is we really want to go for smarter access, and by that, to antibiotics. By that I mean unblocking access in a way that is informed by stronger surveillance of these bugs, diagnostics, and data. That's why we've just joined with civil society and governments to fund GARD-P, which is building a more robust and data-driven approach to access to high-quality, effective antibiotics. It's also about stewardship, from responsible manufacturing of antimicrobials to education to appropriate prescribing and usage compliance. All of those things are crucial to smarter access. And we need better innovation, a pipeline of new antibiotics sooner. We at GSK have about 30 AMR-relevant projects, 13 of them targeting the most critical pathogens from the WHO. But the industry level and pace of innovation for AMR has actually halved in the last decade. So what I'm hoping from this week is we're going to see some collective action from governments to stimulate discovery and development of the new and different antimicrobials that we so desperately need, which again needs to be built on a foundation of prevention and more partnership. We've got to stop the infections happening in the first place. That's better control, access to sanitation, more vaccines. And we've got to work together in new ways to counter resistance. So we invested £45 million this year in the Fleming Initiative with the Imperial College in London, which is all about trying to find and test out new AMR solutions. So it is a real, present danger that's going to become a much, much more serious problem. But there are reasons for optimism, and that's why it's on the agenda this week, and there is absolutely no time to lose.
Well, there are certainly reasons for optimism, partly because of kind of the leadership from WHO and GSK, although I am still stumbling over what you shared a minute ago about kind of the level of research around AMR that has dropped so precipitously.
Yeah.
And so hopefully kind of the focused attention, kind of a new set of incentives and also public pressure collectively will kind of drive more research from academia and industry alike. Dr. Tedros, I want to kind of pick up on Emma's theme of partnership. We here at CGI and the Clinton Health Access Initiative have been so grateful to be in partnership with WHO in many ways over now decades. And so I know kind of how kind of innovative you already been thinking about kind of what partnership can effectuate and sustain. I wonder if you can share a couple of examples, recent or not, of partnerships related to climate change and health or kind of any other area that you want to share.
Yeah. No, thank you. I will come to the partnership issue later, maybe a comment on AMR. One of the major challenges is AMR, and we even call it a silent, antimicrobial resistance is a silent pandemic. And as you know, we will have the high-level meeting of the UN after tomorrow, that's on Thursday. And countries are now agreeing on a political declaration on governance, on financing, on use of antibiotics in animals, in humans, in agriculture. And there are very good commitments already outlined. I think what's important now, though, is we have this cycle of commit and forget. So I hope this commitment will be implemented, and we will not repeat the cycle of commit and forget. Then to partnership, maybe two examples with the private sector and also with a foundation or initiative like the CHAI. When I was Minister of Health in Ethiopia, President Clinton visited us. And he asked me, what are your priorities? In what areas would you like us to help you? Then I said, can you help me in hospital reform, whether it's the secondary or the primary hospitals? Because most of the donor money actually goes to very sexy, disease-specific support, while health service reform doesn't get the attention it deserves. And he said, of course, we are here to support you. We will support you based on your priorities, and that's why we're here. If you don't want us, we go, but if you want, if this is your wish, we will support you. And then we started the hospital reform. CHAI, the Clinton Foundation, brought Yale University, and then the partnership grew, and many other partners joined, and we did the reform, and the reform resulted in a well-governed, led by a CEO health system that improved the quality of services in hospitals, that minimized the death in hospitals with better processes. And that's one area where I can say a very successful partnership. It really was a significant one. But one thing that impressed me, and which is very important here, is normally when we come as donors to countries, we try to prescribe instead of asking the countries, what do you want? Because countries know the problem, they know the root cause of the problem, they know the solutions, so it's very important to support them based on their priorities. And that's why that project was a success. And not only President Clinton, but other members of the team were saying exactly the same. We support you based on your priorities. And the other partnership is with EMA, with GSK. After the malaria vaccine was proven to be effective, but there were some challenges, financial and so on. This is in 2019, and before we moved into the piloting, there were signals that GSK may drop out. And I called Emma and said, no, this is very important. I had to nudge her.
It's very effective.
Strong. Then she said, okay, this is the malaria vaccine called RTSS. And then we agreed, but she was really committed, so it didn't take much to really agree on going forward. And now we have one vaccine, RTSS, and I did my studies, my master's and PhD on malaria. So for me, it was personal, actually. Okay. And that partnership is one of the very successful, and children in Africa are being saved because of the RTSS vaccine. So this is partnership between WHO, a global institution, and pharma industry. And by the way, Gates Foundation and many other partners, Gavi, Global Fund, and others. And the CHAI partnership, it's country level, based on country priorities, and making a difference in reducing deaths, especially in hospitals, and improving the quality of care. And we have Joe here, the patient safety champion, and that was part of the package of the reform, the reform that made a difference. So partnerships work, but partnerships should be focused on a goal and based on putting the countries in the driver's seat, especially at country level. Thank you.
Well, partnerships work also when we have extraordinary leaders like the two of you. So really, thank you both so much for being here. Good luck in hopefully tackling all the partnerships that are needed to help us finally kind of put AMR in the rearview mirror. We're incredibly grateful to both of you. So please join me in giving our panelists a round of applause. Thank you.
Thank you.